Welcome. I'm Dr. Anthony Goodman, and this course is Understanding the Human Body, an Introduction to Anatomy and Physiology. This is the first of 32 lectures in which we're going to study the anatomy and then the physiology of all the organ systems in the human body. We're also going to make correlations in the pathophysiology and the pathology, the abnormal structure and the abnormal function of systems of the human body. We're actually going to study this slightly differently from the way it's studied in medical school. Medical students dissect cadavers and they study regional anatomy. We're going to be looking at systems anatomy. The medical students need to know, for example, what organs and structures lie next to each other so that in the operating room they will know where they have to be very careful, where they can make some time, and what has to be protected. They can't really study systems in a human body when doing a dissection. We can do that here. We're going to look at each system one at a time, and then we're going to compare the physiology and the diseases that can happen to that physiology. Today we're going to look at the heart and the structures that are part of the physiology of the heart. The heart used to, for centuries, define death. If the heart was beating, you were alive, and if it was not, you were dead. That was the legal definition, and it was the physiologic definition. Today we define it by brain death rather than heart death because of the advent of organ transplantation. But still, without the heart, nothing else would be working. So we're going to begin here with the heart of the matter and talk about this wonderful pump that can pump 20 gallons a minute, an enormous volume, which weighs less than a pound, which can go on for 100 or more years and rests a fraction of a second on every beat. It's a tireless, energetic organ that can pump approximately 1.5 million gallons per year, year after year, and rarely has any malfunction until the time it's ready to give out and the patient dies. We need to study in the beginning the types of circulation in the body, and there are generally two types of circulation. If we look at the first slide, you'll see the heart in the center, and this is highly schematic. This does not reflect the way it is anatomically, but basically we have two systems going on. We have what's called the systemic circulation, meaning the blood that is going out of the heart and feeding all the organs of the body. This shows schematically the brain, and down in the rest of the body, which would include the organs of the chest, the abdomen, the extremities, the muscles. That's the systemic circulation. Blood returns to the heart through veins to be pumped out again. There's a secondary circulation. After the blood returns to the heart, it needs regenerating. It needs to get air from the lungs, oxygen, needs to get rid of waste gases. So it's pumped out to the lungs, where it is oxygenated, and then returned to the heart, and that's called the pulmonary circulation. And these are two parallel and separate circulations that have a different function and a very, very different anatomy. In general, when people think about the heart and the lungs and the circulation, they think about arteries carrying oxygenated blood, and they think about veins carrying blood without oxygen. And that's not really a good definition. We come back to the slide. In general, the systemic circulation, that holds true. Blood leaving the heart, going to the body, or going up to the brain and the upper extremities, does carry oxygen. So those vessels in the arteries are carrying oxygenated blood. But if you look at the pulmonary circulation, the vessels going out to the lungs, the pulmonary arteries, are carrying deoxygenated blood. And the oxygenated blood is coming back toward the heart. So that definition doesn't hold very well. We really have to define arteries and veins by the direction of blood flow. Arteries pump blood away from the heart, including the pulmonary circulation, which is going away from the heart, and the veins bring the blood back to the heart. And here we have oxygenated blood coming back in the pulmonary veins. Now, the location of the heart is another area that is sometimes confused. People think of the heart as being on the left. We pledge allegiance with our hand over the left side. We make little hearts and fencing costumes over the left. The heart is really not on the left. It's in the dead center of the body. And if we look at the next slide, this is a cutaway view of the chest. Now, I want to get into a few definitions of how we look at these pictures. This is a view of different planes of the body that we're going to be using. The plane I just showed you is a frontal plane. It's as if we sliced the patient right up the middle, facing us. And we're looking at the heart through that frontal plane. We're going to also look in this section at a transverse plane, which cuts the body horizontally. And then we're going to look at sagittal planes, which cut the body up and down. Getting back to the position of the heart in the body, you can see that there is an enormous cavity called the thoracic cavity. This is the chest. It's bounded by the ribs. It contains basically three sections. It contains the right and the left lung on both sides. And then down the middle is the heart, occupying almost the entire center of the thoracic cavity. Now, it's absolutely right in the middle. You can see a little bit of the heart sticks over more on the left, but primarily it's a midline structure. And all three cavities are separate. The left lung here is in its own enclosure. It does not communicate with the heart in any major way. The right lung is in its own enclosure, and then the heart and the great vessels are in the middle. This middle area is called the mediastinum. And the only functioning structure in the mediastinum is the heart itself. The vessels leave the heart and go to their various places through the mediastinum, and there are a couple of other organs which traverse it. For example, the esophagus goes from the head down to the abdomen, but doesn't really do any business in the mediastinum. It's just a conduit. It's just a street. So we're really interested only in the heart by itself. Now, if we look at this through a horizontal section, taken right through the chest, we get some interesting anatomy. This is the patient's front. This is the patient's rear. And this is the right, this is the left. If you remember, when we looked at the sections, here's this transverse section again, also called a horizontal section, cutting through the patient. It is our convention to look at this on a slide or an X-ray or an MRI as if we're looking up at the section, so that the patient's right still comes out on the right, the patient's left is on the left. Now, in this slide, this is the patient's right, showing the lung. This is the patient's left. And here's the heart sitting pretty much what we call anteriorly, or to the front. The opposite of that is the posterior portion, or the back. Look at the position of the heart relative to hard structures. Here's the sternum, or the breastbone. And here is where the backbone comes into the chest cavity. So you have two very firm, fixed structures on either side of the heart. The sides are pretty soft. That's where the lungs are. And if you think about what's over here, these are the ribs coming around the side. Now, the ribs are very flexible and compressible. And this brings us to our first clinical application, cardiopulmonary resuscitation. The heart is positioned right in the middle of two very hard structures with flexible structures on either side. This allows compression of the chest and the sternum against the backbone with the heart in the middle. In the old days, before we realized you could actually pump this way, we used to open the chest when it stopped. Somebody in a hospital or an emergency room had a cardiac arrest, we would go ahead, we would open the chest with a knife, the surgeon would stick his hand in and squeeze the heart with his hand. It was very efficient. It's actually more efficient than closed massage. But it was also very invasive, very aggressive. And there was a certain mortality, death, and morbidity, meaning bad complications, with that kind of massage. Today, still, in the operating room, we use open massage if the chest is already open and the heart stops. It's also another way to start the heart. But in the absence of an open chest, we still go to cardiopulmonary resuscitation, in which, as you probably know now, we press on the sternum. The sternum has some give in it because of the ribs, and we are pumping the heart against the backbone and the sternum. The blood output is about 80% of what you can get if you did it by hand, but it's still adequate for good circulation and to resuscitate a patient. The next topic is the pericardium, the coverings of the heart. And this is a subject which is good to dwell on at this point because it's going to be very much related to other coverings in the body, and a good understanding of the embryology is really very important. The heart isn't sitting there in the cavity by itself. It's not sitting in the chest free, but as you can see, the cut edge here in this plane has a little sac around it called the pericardium. Pericardium, meaning around the heart, is a tough, fibrous sac that holds the heart in place and gives it some protection. It also protects the heart from overexpansion in diseased states. This is a two-edged sword. And the way it forms is really rather interesting embryologically, and it's exactly the way the coverings of the lung form, the pleura, and it's also analogous to the way the coverings of the intestines form. So it's worth a minute to look at that right now before we go ahead. If you can imagine yourself sitting in a closet or a coffin or a small room, and you represent the heart. And if you were to take a balloon, which is going to be the coverings, and start blowing that balloon up, the balloon would expand away from you until it reached the walls of the enclosure you're in, let's say a closet. It would then, as you continue to blow, press against the walls and line the walls, floor, ceiling of that closet. That's what we call the parietal pericardium. It is the wall, parietal means wall, covering. If you continue to blow, what's going to happen? The balloon is going to start coming back at you and press around your face and body as it has no other place to go. It's eventually actually going to meet behind you. That very thin layer that's covering you is what we call the visceral pericardium, and it's tightly adherent to the heart itself. Now think about that space. There's now a space between you, covered in this thin layer of pericardium, the visceral pericardium, and the wall, the parietal pericardium. And that's exactly analogous to what we have in the heart. There is a space, it's actually only a potential space, and it's filled with fluid, a lubricating fluid that allows the heart to pump without rubbing or being irritated by the pericardium. If you look at the layers that they show here, you can see the visceral covering of the heart. This is a section through the heart and the pericardium. Here's the cavity that's only the potential space. And this is filled with a thin layer of lubricating fluid that's regenerated and renewed all the time. And then you have the layer of the parietal pericardium, the wall, the tough end of that. Now, this pericardial anatomy has some aspects to it that lead to pathology, things that we can get in trouble. While it has given protection to the heart, it also has the problem that there may be too much rigidity, too much protection. For example, you can get something called pericarditis. The suffix itis means inflammation. Appendicitis, for example, meningitis are all words you've heard. These just mean inflammation. Arthritis, inflammation of the joints. Pericarditis can be caused by viruses and other infections, and when the heart and pericardium become inflamed, they begin to rub and irritate. This causes chest pain. It can cause difficulty in pumping. It